again students, here we come up with the hip joint. That is lecture number 3, and in this we are going to discuss the muscles which are producing the movements of the hip joint. Along with that we are going to discuss the arterial supply, we are going to discuss the nerve supply, we are going to discuss the relations of the hip joint, what are the structures anterior, posterior, superior, inferior, and we are going to discuss the applied anatomy. So these are the points which we are going to discuss as of today. First will be the muscles which produce the movements. In the muscle producing movements, here we just write the flow chart so that it will be comfortable for you people to understand. So muscles producing movements, the first will be flexion. Flexion of the hip joint is on transverse axis as well as extension. So flexion and extension will be on transverse axis. The flexion of the hip joint, many times it is asked in one question answer MCQ that if the knee joint is extended, the flexion will be around 90 to 100 degrees. In case the knee joint is flexed, then the flexion of the hip joint may extend up to 100 to 120 degrees. In flexion of the hip joint, the joint becomes loose packed. And in extension of the extension of the hip joint, the joint becomes close packed. Once again I'll repeat, in flexion of the hip joint, the joint becomes loose packed, and in extension of the hip joint, the joint becomes close packed. Now, what are the muscles which will produce this flexion and extension? That is very important. Many times it is also asked this question as MCQ or 1 mark question as a flexion. The muscles that produce flexion will be the pectineus, psoas major, there will be the straight head of rectus femoris, as well as there will be the muscles which are present just anterior to the hip joint. So some fibers of sartorius are also involved in this flexion. What are the muscles which will produce the extension? For the extension, the muscles that produce extension of the hip joint will be, they are the gluteus maximus, along with gluteus maximus, hamstring group of muscles. The hamstring group of muscles are involved in extension. The major muscle which causes flexion is known by this name. What is the name? Iliopsoas muscle. So this iliopsoas muscle is the major muscle which causes flexion of the hip joint. Combination of iliacus and psoas major. Extension by gluteus maximus and hamstring group of muscles. Now, there will be abduction and adduction. So, abduction as well as adduction. Now, please note down, these two movements will take place on anterior-posterior axis. Many times this is also asked in 1 mark question answer. Flexion extension on transverse axis, abduction adduction in anterior-posterior axis. Now, which are the muscles? That is very important. The muscles which produce, first we take adduction. They are all adductor group of muscles. All adductor group of muscles. They produce adduction of the hip joint. What are the abduction of the hip joint? Abduction, very important. This is asked in MCQ. Abduction is produced by, number 1, please note down, gluteus medius. Number 2, gluteus minimus. Number 3, tensor fascia latae. Tensor fascia latae. And the 4th muscle is sartorius. 4th muscle will be sartorius. These 4 muscles will form the abduction of the hip joint. It is asked frequently, this question. You may get the 4 choices. One of the choices will be out of these 4 muscles. So abduction of the hip joint will be done by gluteus medius, gluteus minimus, tensor fascia latae and sartorius. Please note down, abduction of hip joint. Now, first group flexion extension, second group abduction adduction, third group will be, this is also very important, medial rotation lateral rotation. Both these movements, medial and lateral rotation, will take place on vertical axis. On vertical axis, medial and lateral rotation. Lateral rotation, first you take lateral rotation, is produced by here. This is the muscle gluteus maximus. And second will be the structures which are lying just below gluteus maximus. During dissection we have seen when we reflected gluteus maximus, all the muscles which are lying beneath the gluteus maximus will help in lateral rotation of the hip joint. What are those muscles? They are piriformis, then they are gemelli muscles, superior intergemelli, then obturator internus. These are the muscles. Quadratus femoris, they will produce help in lateral rotation of the hip joint. Medial rotation. Medial rotation is done by gluteus medius, gluteus minimus and tensor fascia latae. Please note down these three muscles. These three muscles will help in medial rotation of hip joint, gluteus medius, gluteus minimus and tensor fascia latae. And now the most important one mark question answer, that will be if I write down psoas major. Now this psoas major muscle will produce both the movements, medial as well as lateral rotation. Psoas major muscle will function if the foot is on the ground. When the foot is on the ground, then medial rotation of the hip joint is done by psoas major muscle, or psoas major muscle will produce medial rotation of the hip joint when the foot is on the ground, and the same psoas major muscle will produce lateral rotation of the hip joint when the foot is above the ground. Once again I repeat, psoas major muscle will produce medial rotation of the hip joint when the foot is on the ground, and the same psoas major muscle will produce lateral rotation of the hip joint when the foot is above the ground. It should be very clear. Please note down, very important one mark question answer. So here we finish our muscles which produce the movements. Then we come to relations. We'll take relations first. We come on this side. Now in the relations, first you take what are the muscles which are lying anterior to the hip joint. We just have to name the muscles. We have to write the muscles in the flow chart. And remember, these questions can be asked in one mark question answer also. So in the relations of the hip joint anteriorly, there are the following muscles. Which are the muscles? They are pectineus, then iliopsoas, then adductor longus, and sartorius. And what are the nerves and vessels which are lying in front of these, in front of the hip joint or anterior to hip joint? This is very important. This we have discussed in femoral triangle also, but here also it should be included. Femoral nerve. What is the exact location of femoral nerve? Femoral nerve is lying just anterior to the iliopsoas groove. The groove between iliacus and psoas major muscle, anterior to it will be femoral nerve. Then we come to psoas major tendon. In front of psoas major, there will be location of femoral artery. In front of psoas major, location of femoral artery. And then we come to pectineus. Just in front of pectineus, there will be location of femoral vein. These three structures, very important. Then there will be groove between pectineus and psoas major muscle. In the groove between pectineus and psoas major muscle, there will be passage of the medial circumflex femoral vessels. And in the groove between pectineus and adductor longus, there will be passage of profunda femoris vessels. So these are the structures which are lying anterior to the hip joint. Now the structures which are lying posterior. Now posterior to the hip joint, remember the gluteal region. I will name only the gluteal region. The entire gluteal region here will lie posterior. And what are the structures which are involved in gluteal region? Gluteus maximus, gluteus medius, structures lying below that, sciatic nerve, the piriformis muscle, obturator internus, superior gemellus, inferior gemellus, quadratus femoris, etc. All these structures, inferior gluteal nerves and vessels, they are lying in the gluteal region. They are lying posterior to the hip joint. Then comes superior. This is very frequently asked question, superior and inferior. 1 mark question answer. These two structures are frequently asked. Which muscles are lying superior to the hip joint? Please note down. Superior to the hip joint, there will be reflected head of rectus femoris. First structure, the first muscle, reflected head of rectus femoris, and second structure will be gluteus minimus muscle. Gluteus minimus muscle. These are the only two structures, these are the only two muscles which are lying superior to the hip joint. Reflected head of rectus femoris and gluteus minimus muscle. Inferior, the structures which are lying inferior to the hip joint. Once again, note down, obturator externus muscle. Obturator externus muscle. And second muscle will be pectineus. The second muscle will be pectineus muscle. These are the two muscles, two structures which are lying inferior to the hip joint. Please note down, obturator externus and pectineus, inferior to the hip joint. So here we finish the relations. Please come on this side. So we have finished the relations. Now we will consider both this arterial supply, nerve supply. Now please come on this side. In the arterial supply and nerve supply, the arterial supply, even the arterial supply and nerve supply, you just have to remember the name of the arteries and name of the nerves which you need to mention. So it will be helpful to you during 1 mark question answer also, or in MCQs also. A lot of MCQs are asked based on this. Arterial supply will be, just remember in this way, the superior gluteal artery, inferior gluteal artery. These are the two gluteal arteries. Same, there will be obturator artery. Obturator artery. So superior gluteal artery, inferior gluteal artery, obturator artery. Anteriorly, in the front, there will be medial circumflex femoral artery, lateral circumflex femoral artery. These are the 5 arteries which will supply the hip joint. Very easy to understand, very simple to remember. Superior gluteal artery, inferior gluteal artery, obturator artery, and medial circumflex femoral artery and lateral circumflex femoral artery. 5 arteries which supply hip joint. Now the nerve supply. Here I will write the nerve supply. Total 6 nerves you have to remember. We start from the front. There is nerve to rectus femoris. Nerve to rectus femoris muscle. So therefore it is a branch of femoral nerve. It is a branch of femoral nerve to rectus femoris. Second nerve will be obturator nerve. Which division of obturator nerve? Anterior division of obturator nerve. The anterior division of obturator nerve. Third will be accessory obturator nerve. Third structure. Fourth will be posteriorly. That is branch of sciatic nerve. Branch of sciatic nerve or sciatic nerve, whatever you can pronounce. So this is the fourth one, branch of sciatic nerve. Then fifth one will be superior gluteal nerve. Superior gluteal nerve. And the last one, sixth one will be nerve to quadratus femoris muscle. Total 6 nerves. Once again I'll repeat. Nerve to rectus femoris, there is a branch of femoral nerve, anterior division of obturator nerve, accessory obturator nerve. Then we are having the branch from sciatic nerve. Then we are having superior gluteal nerve and nerve to quadratus femoris. These are the 6 nerves which supply nerve supply. Now please come on this side. So here we have finished the nerve supply, arterial supply, nerve supply. Now the last point will be the applied anatomy. So please come on this side. In the applied anatomy, what you need to mention, what you need to remember will be number 1, Perthes disease. The spelling will be Perthes, Perthes disease. Now this Perthes disease you need to mention only 1 or 2 points. It occurs in childhood. There is avascular necrosis of the head of the femur and it may be because of trauma. Because of trauma in childhood, there may be avascular necrosis of the head of the femur, which is called Perthes disease. So these are the 3 points. In childhood, avascular necrosis of the head of the femur, and reason is because of trauma. Perthes disease is over. Now second important point in applied anatomy will be coxa vara. So please write down coxa vara. In coxa vara, the neck shaft angle is decreased. That is important. What is coxa vara? It is the decreased neck shaft angle. The femoral neck shaft angle is decreased in coxa vara. This coxa vara, the reason why coxa vara occurs, it occurs because of number 1, Perthes disease, and number 2, rickets. So 2 main reasons, Perthes disease and rickets may produce coxa vara where the neck shaft angle is decreased, and here in coxa vara the abduction movements are limited. Why the abduction of the hip joint is limited? Because the neck shaft angle is decreased and because the greater trochanter during abduction will cause impingement on the gluteal surface. That is why the abduction movements are limited in coxa vara. Third, applied anatomy. So first is Perthes disease, second is coxa vara, third will be congenital dislocation of the hip joint. Please note down, congenital dislocation of the hip joint. So here I will write down congenital dislocation of the hip joint. Now here, this is many times asked in 1 mark question answer. Please note down the points. All these points can be asked. This is more frequent in girls. So it is more frequent in girls. Please note down. Second reason will be, why it is more frequent in girls will be, the reason of this congenital dislocation of the hip joint will be, now these 3 reasons are very important. Number 1, the pelvic wall, which is formed by the ilium, blades of ilium, may be more vertical. That is the first reason. Second will be, there will be acetabular cavity which is very shallow. The acetabular cavity will be shallow. And third will be the buttress, acetabular buttress. The acetabular margin is very thick posterior superiorly, which is called the buttress of the acetabular margin. That buttress may be absent. So because of these 3 cases, these 3 reasons, it is very common in girls, and this congenital dislocation of the hip joint occurs in the posterior region, in the posterior direction. So please mention in the posterior direction towards the gluteal surface. It is displaced towards the gluteal surface. And in this congenital dislocation of the hip joint, along with it there will be coxa valga. Coxa valga, opposite to coxa vara, coxa valga, where the neck shaft angle will be increased. So coxa valga will be associated with the congenital dislocation of the hip joint coming up. So therefore, this coxa valga is called increased neck shaft angle. And which movements are limited in coxa valga? Adduction movements. So these are the points which you need to consider in congenital dislocation of the hip joint. First is Perthes disease in applied anatomy of the hip joint. Second is coxa vara. Third will be congenital dislocation of the hip joint. And fourth, if I write on this side, the fourth one will be the fracture of the neck of the femur. This fracture of the neck of the femur you need to mention is very common applied anatomy of the hip joint. The causes may be trauma, or the causes may be because of old age, or fall down in the old age, etc. And the last point in applied anatomy will be radiological study of the hip joint. During the X-ray study of the hip joint, which we discussed with students in the practical classes, during the radiological study of the hip joint, in order to understand the normal anatomy or the normal location of the head of the femur within the acetabular socket, or in order to understand whether the hip joint is displaced, there is a dislocation of the head of the humerus from acetabular cavity, three important lines are to be studied. You just have to mention the three important lines. These three lines in detail will be taught to you by your teachers in the various demonstration classes. And what are the three lines which we need to mention here in theory? Those three lines will be for the radiological study of the hip joint in order to understand the dislocation of the hip joint. They are the Nelliton's line, then Bryan's triangle, or it is simple called Bryan's line, B-R-Y-A-N-T-S, Bryan's triangle or Bryan's line. And third will be Shenton's line. In applied anatomy, you will not go in detail in all these three lines. What are these lines? Just have to mention these three lines in applied anatomy. In practical, during X-ray study and in Viva, you need to understand what are these three lines. So here, these are the applied anatomical features of the hip joint. Perthes disease, coxa vara, congenital dislocation of the hip joint which includes coxa bulga, then fracture neck of the femur you just need to mention, and the radiological study in which you need to mention the Nelliton's line, Bryan's triangle, and here please come on this side, Nelliton's line, Bryan's triangle, and the Shenton's line. So therefore, these are the points which you need to mention in applied anatomy. So therefore here we have finished all these important points in the hip joint. With this we end the hip joint. Thank you very much.